Recent bibliography offers compelling case studies about the effectiveness of music therapy in the treatment of various psychosocial conditions, such as schizophrenia, anxiety, and depression. Important examples include Auntie Saddle's 2013 study of music therapy as a treatment for youth experiencing identity and mood disorders, and Jane Edwards' study of the effects of music therapy on people with mental disorders. Of particular interest is the work of C.B. Hendricks that demonstrates the effectiveness of group music therapy in the treatment of adolescent depression. Hendricks' study demonstrates that the use of music therapy techniques is positively correlated with reduced depression and increased self-concept scores amongst middle school and high school youth. In this paper, I built on the research to examine the potential of music therapy to treat adolescent depression exacerbated by a home stressful environment. I propose that music therapy is especially effective for adolescents in a stressful home environment. This paper is divided into 3 parts. First, I will discuss the causes and effects of depression on adolescents. Next, I will present music therapy theory and methodology of demonstrating how it is particularly beneficial to people experiencing depression. And finally, I will discuss the importance of removing stress in the environment of the client in the excessive music therapy treatment. It is important to note that this paper also serves as a first step in a long-term project. After graduation, I aim to open a treatment center for adolescents experiencing depression. The treatment center will involve various types of therapy for its residents, including music therapy and equine therapy. I sincerely welcome any suggestions and comments from the audience that could contribute to the creation of an effective treatment center. So part 1, depression and environmental stress. As defined by the textbook, Essentials of Understanding Abnormal Behavior, depression is a mood state characterized by sadness or despair, feelings of worthlessness, and withdrawal from others. Symptoms can include feelings of emptiness, apathy and anxiety, appetite and weight change, and thoughts of suicide. Depression causes abnormalities in the brain and hormone regulations, and in the availability of important neurotransmitters that affect mood stability, like serotonin, norepinephrine, and dopamine. Depression can also cause unhealthy coping skills when a person is faced with challenging and stressful situations. It has been proven to increase the risk of self-harm, eating disorders, and substance abuse among adolescents in the U.S. Persisting depressive symptoms can increase the risk of suicide. Depression is especially prominent amongst adolescents. 14% of adolescents report symptoms of depressive or bipolar disorder. According to the National Institute of Mental Health, around 11% of adolescents have a depressive disorder by the time they're 18 years old. In fact, depression has become so widespread and so crippling that it is now the leading cause of disability for Americans 14 or 44 years old. It is especially crucial that we address adolescent depression, as there is a strong connection between depression, suicidal ideation, and suicide attempts among adolescents. Suicide is the 3rd leading cause of death among adolescents 15 to 24 years old. While biological and psychological factors like genetic predisposition and self-destructive behaviors can lead to depression, research suggests that results from the additional influence of environmental factors. These can include experiencing maltreatment as a child or stressful life events such as parental divorce, abuse, substance abuse, and loss of a friend or family member. In addition, a 2006 study by epidemiologist Dr. Robert Onda shows that people exposed to stressful or traumatic situations at a young age have increased irregularities in their stress response system. According to research at the American Psychological Association, chronic everyday as well as exposure to traumatic events maintains a direct correlation with anxiety and depression. Part 2 is music therapy and depression. Music therapy is a relatively new means to treat depression. According to the Music Therapy Association, music therapy is defined as the clinical and evidence-based use of musical interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. In 2001, a study by Dr. C.B. Hendricks, a professor at Texas Tech, indicated that the use of music therapy techniques was positively correlated with reduced depression and improved self-perception for both middle school and high school participants. In addition, Dr. Jane Edwards, director of the music therapy program at the University of Limerick in Ireland, researched music therapy and the treatment of mental disorders and found that music therapy to be a structured interaction where participants are able to manage some of their symptoms and express feelings related to their experiences. Anna Moratos, a registered music therapist, states that music therapy is particularly effective for treating depression because active music making within the therapeutic frame offers the patient opportunities for new aesthetic, physical, and relational experiences. According to Moratos, depression is linked to a lack of pleasure and meaningfulness in life. In music therapy, participants can experience themselves differently and aesthetically when playing music. Playing music also gets people moving actively, which has been linked with improving symptoms of depression because of the release of endorphins. And it also helps participants to see themselves as physical beings. Lastly, playing music can facilitate the process of self-discovery and relation of self to others. Part 3 is removing environmental stressors. I propose that offering music therapy to adolescents in a stress-free environment could help alleviate symptoms of depression. The hypothesis is based on the findings of numerous researchers. The American Psychological Association found that the following 5 activities is useful in relieving stress: taking a break from the stressor, exercising, smiling and laughing, having social support, and meditating. The APA states that if one is away from the stressor, one will have a chance to do something else with the time that might be otherwise spent worrying or dealing with a stressful situation. As such, one can try different techniques to deal with the stress in a healthy way. Licensed professional counselor Stephen Gifford demonstrated that residential programs are safe, structured environments where participants are removed from stressful circumstances. The absence of stressors allows the resident to begin to work on building life skills. An adolescent participating in a music therapy program in a stress-free environment can focus on learning how to deal with stress in a healthy manner. Music therapy can be especially effective in a setting away from a stressful home environment because more time can be spent working on coping skills and combating depression as opposed to constantly worrying about the stress. In addition, residential treatment centers have been proven to be particularly effective with adolescents. Dr. Valerie Shapiro conducted a study on the effectiveness of residential treatment centers with adolescents. She found that residential facilities offer more opportunities for therapeutic contact and a more direct evaluation of aftercare options. Assessments that are hard to do as an outpatient can be done at these facilities, and interventions can be watched particularly closely. Residential treatment centers can also cater to the needs of specific populations. For example, adolescents usually differ from adults in their means of communication and in their views of authority. So to conclude, in this paper, I examined current research on music therapy as a tool for combating depression exacerbated by a stressful home environment. While stress is not a direct cause of depression, it has been found to have a positive correlation. I propose that music therapy is an especially effective tool when adolescents are removed from their stressful environment and participate in intensive music therapy. This is because without the presence of constant stress, adolescents can focus on developing healthy coping habits. Further research is needed in the form of observing what actually happens when depressed adolescents are removed from their stressful home environments and participate in intensive music therapy. To this end, I plan to open a residential music therapy treatment center. While a detailed description of the treatment center that I plan to found lies outside of the scope of this paper, I'd like to share with you a few general ideas. The treatment center would have a warm and welcoming atmosphere where adolescents can recover from their stressful environment. It will be staffed with licensed music therapy professionals and counselors and offer a supportive and structured setting. The adolescents would willingly come to the center with parental permission, and they would have a place in a treatment program with a focus on active music making, which can relieve symptoms of depression. Other therapies, including counseling, would be incorporated into the program. I believe the freedom from the stressful environment mixed with intensive music therapy will benefit adolescents struggling with depression. Thank you very much.
5 minutes for questions.
What would you say, like, is there maybe a diversity in the types of music that's more effective for certain kids?
I actually spoke to a music therapist here in town, and she said that it's different with everyone. Obviously, happy songs are going to be played rather than sad songs. and they can either have songs already written or they can make their own music up, and they often discuss lyrics too, and make their own lyrics up to the same songs too. So yeah, it's just different for every person. Yeah.
Do you have a time frame in mind that you would have the kids to stay in the residence, or would you?
It's going to be based once again on personal things. Depending on how bad the depression is, it's probably going to be in like the range of like 2 weeks to a month, like starting out, and then we'll kind of just play with it to see. And I plan on going to different residential treatment programs around the area, trying to figure out what they're doing and what's working and what's not working.
Would you want to have like an extended thing where they would still get therapy once they left the residency, or would it just be while they were there?
That's a good idea. I haven't thought about that really, but I would definitely take that into consideration. Yeah.
A couple things. One, clarification just on the type of stress. So saying that to be removed from the stressor is really helpful is part of the steps. And I think the distinction is that it's stress that the adolescent can't control, correct? It's environmental, it's things going on in their home. My reason to clarify that is I think that if the stress is something you can control, then dealing with it would be the better option, right? Rather than the avoidance. But I think that when it is out of your control, that makes it completely different, and that does make that separation really helpful.
Yeah, and a big thing with adolescents is if their home is not a good environment for them, they really don't have the option except to run away to get out of their home.
Right.
So this is a safe place where they can go.
Right, and if it's things that are going on with their parents or their caregivers, then it may have nothing to do with them anyways. And then just a second thing to ask, do you think the incidence of depression in the adolescent population has increased over the years, and why or why not would you sort of think that?
Some of the research I was looking at has said that it has increased. It's going up, and it might be just awareness, more depression, or it just might be, the world's getting a little bit more different, and like parents or, the divorce rate, as we know, has risen from a while ago, and that's a big cause of environmental stress in the home.
Yeah, I think social media has a big role to
Very
play
much
too,
so.
Right, because we're constantly seeing everybody's best selves and best selfies, and that kind of makes us
feel like you're popular enough.
Right, I think that is a huge correlate here too.
Yes, thank you.
Actually, just branching off of that, it's something I haven't thought of that at all, and we've talked a whole ton about this, but let's say you remove the adolescent from the stressful environment and they feel better, and then you send them right back into it, which is probably filled with issues. I wonder if there's some element of the treatment center, or I don't know exactly how you would frame this, but to try to also resolve the issues at home in some way. To deal with the stress. Parental
I actually have thought about this. The big thing when they're actually in the center is to treat them or to teach them how to treat or deal with their depression and their stress in a healthy manner. So that's one of the things, is to teach them how to do that. Another thing is we will talk to the parents and address them if they're willing to listen, because obviously some parents do not want to listen to this kind of stuff. But we're going to talk to them and offer them some advice and some pamphlets or some information on how to better help. I know with parents of divorce, they're often given pamphlets of how to deal with their children, because divorce is very stressful in children usually, and they're given things to do and what not to do, and that might help with. You can't change your environment. There's no control over that, but you can try your hardest.
I wonder if maybe a little bit of family counseling or something.
Yeah.
I don't know if that's outside of the scope of your treatment center.
Good think about it. So. Anything else? Right. Well, thank you very much.